before I tell you more about myself, let's talk about the elephant in the room. What is a registered dietitian? So whenever I go for functions, I meet people at meetings, the first thing, as soon as I tell them I'm a dietitian, they ask me about weight loss tips. They ask me, what do I feel about the new injections on the market? And that's not what we do as dietitians. That's not our sole purpose, weight loss. So what I want you to do is take out your phone right now and let's type in what is a dietitian or what is a registered dietitian on whatever you're looking at, and let's see what comes up. So a registered dietitian is a qualified healthcare professional who specializes in food and nutrition, providing expert advice to support health and manage medical conditions. They are medically trained, require university-level education, and must be registered with HPCSA to practice. Dietitians offer services like personalized meal plans, medical nutrition therapy, and nutritional counseling. So that means I'm not a specialist in weight loss only. We've got so many other areas that we deal with. My name is Dr. Laurencia Govender, and I am a registered dietitian with HPCSA. I'm a senior lecturer and a researcher in the discipline of dietetics and human nutrition in the School of Health Sciences, and I'm based in Pietermaritzburg campus. Just a little bit about me. I hold a BSc, a postgraduate diploma, MSc summa cum laude, and a PhD in dietetics, which I obtained at UKZN. So I am loud and proud graduate of UKZN. I have 15 years experience as a dietitian, and I did not start off in academia. I started off in clinical. I did my community service in Dundee Hospital, and I had a lovely experience. But before I get to that, usually I start this with my students and I ask them, why have you decided to do dietetics? And everybody has their reasons for doing dietetics. But me personally, dietetics wasn't my first choice, and it wasn't something I really wanted to do. I actually wanted to be a medical doctor, and it didn't really work out for me. And my path was, let's get into dietetics, and then I will follow suit and get there. And I always tell my students, I didn't choose dietetics. Dietetics chose me. And I am so grateful for that path. And I'm blessed that, God put me through that path to become a dietitian, because I really, really enjoy being a dietitian. So I did my community service here, and that solidified exactly that I'm in the right space and I'm meant to be where I am. And I was really blessed to have a Department of Health bursary when I was studying. So that meant I had to come back and serve my time. And I started working at Edendale Hospital, now known as Harry Gwala Regional Hospital. And I did I worked there for many years. And I also had the opportunity to train our fourth-year dietetics students while I was there for their clinical block. So I always tell people I am clinical by nature, but when I got to the university, things changed a little bit for me. So while I was at the hospital, my teaching passion started where I was mentoring and training our fourth-year dietetics students. And I really enjoyed seeing them flourish, taking that theory into practice and being able to assist them. And that sparked some excitement for teaching in me. And I had a little void while working in clinical, because we work with a big team in clinical, and you get given different wards and you work with different patients. And my passion was pediatrics, neonates, and surgery. And there's no specializing in our country at the moment. So I decided, okay, how do I further, enrich myself? So that's when I enrolled in for my master's, which I finished part-time. And I also started my PhD. So that leads me to how I have my academic career at the moment. So in March 2018, I actually got the job as a lecturer at UKZN, and I was in the advanced stages of my PhD at that stage, and it was very exciting because it was a new chapter in my life. It was something different, because being clinical by heart and then moving into a community nutrition post is a little bit of a difference. And I actually enjoyed coming in with that clinical experience and showing my students that you do need that therapy experience in order to serve the community, to teach our community members how to eat efficiently, or you also need to understand how the mechanization works in order for you to advise and educate. So when I joined, I was obviously given a community nutrition predominantly role, and I taught third years community nutrition and nutrition education, and I taught the fourth years the research module. I had a group, and I was also finishing off at that stage the postgraduate diploma in nutrition. I had the last student for that, so I was given that module to just end off on a good note. So it was a different experience for me, but it was so exciting because now I was at the forefront of shaping young minds. So it was like this exciting stage in my life. Currently, I teach second years now, and I teach them a little bit of therapy, and I've still got my third year community modules, which is my basis now for my research as well, because I feel that we can do so much at community level. We rather focus on prevention rather than the cure to make sure our community is empowered to help themselves as well. So I do teach from undergrads, and I supervise masters and PhD students. I'm very hands-on a lecturer. My students will tell you that I love going the extra mile with them. I love engaging with them and also thinking out of the box, because there's so many ways we can teach now, and we're getting different types of students. And I'm happy that I'm at the forefront of education with them, shaping their young minds, helping them with their integrated learning. And as they leave us, they will be graduating at a higher level, like as we are here today. In terms of my research interests, I've got quite a bit of research interests. It ranges from clinical and community nutrition to public health nutrition, infant and young child, as I mentioned, PEDS is close to my heart, infant and young child nutrition, food security. And lots of my research was also focused around looking at malnutrition and how we can incorporate indigenous neglected crops as part of everyday life. We know that in today's world, the economy, we can't afford everything. You know, food, some people may have access to food, but it's not affordable. Some people may afford the food, but they may not be able to utilize that food. In terms of malnutrition, we're seeing both overnutrition and undernutrition in our country. So we need to come up with creative, innovative ways that we can help our communities, our South African communities out there, especially our resource poor communities, to try and make small changes to enhance their nutrition. So with my research focus area, I looked at a lot on indigenous crops such as Bambara groundnut, moringa, orange flesh sweet potato, and we know all of these crops are rich in certain nutrients that are needed in our diets. And by us encouraging people to eat these foods and incorporating into their diets, it's going to help to maybe hopefully reduce malnutrition in our country. I always tell my postgrad students, because I have a lot of postgrad students that I'm empowering with research and involving them, especially with my community research, I tell them we need to now try and make these indigenous and neglected crops sexy. We need to make the youth and young people want to eat these foods. So ultimately, my goal is to come up with good nutrition interventions, more food-based interventions that we can integrate into real-life situations and come up with proper strategies or assisting strategies to help to strengthen the food and nutrition security in our country. So that's what I'm hoping for. So at the end of this, I am passionate about my teaching, I'm passionate about my research, and I'm enjoying being at the forefront of everything instead of just implementing what's been given to me.